Have you ever been in such a great mood that you felt as though you could accomplish anything? Or how about the opposite? You felt so sad that even just the thought of getting out of bed was too overwhelming? Bipolar and related disorders, which can be described as an emotional roller coaster, is a classification of mental illnesses that range in severity, where a person will experience extreme shifts in their mood. These highs and lows are caused by the disorder's three main features: mania, which involves engaging in risky, impulsive, or unpredictable behaviors; hypomania, which is a less severe form of mania; and depression. Mania and hypomania can last for days, while depression can last much longer. Meet Brianna. Brianna was recently nominated to become president of an honor society on campus and won. Although she was thrilled for her new role, she quickly realized she was in over her head. Brianna began skipping her classes to focus all of her time on her new duties. She found herself unable to sleep due to racing thoughts and feeling restless. A month later, Brianna was presenting her ideas to the other members of the Honor Society, but her peers were unable to follow what she was saying. Brianna's speech was rapid, and she kept jumping from one presentation slide to another. When Brianna's friend asked her to slow down, she became irritated, stating that she was the one in charge. When Brianna's advisor stepped in and asked if she was okay, Brianna threw her notebooks in anger and ran out of the classroom. Brianna got back to her dorm, slammed her door, and went to bed. When Brianna's friends tried to convince her to meet up for breakfast before class the next morning, she said she felt guilty about her recent actions and that she would be better off dead than ever going back to class. Her friends immediately reached out to the university's counseling center and got Brianna connected with a mental health counselor. With her counselor, Brianna opened up about her life experiences over the last few years and began to identify her cycles of hypomania and depression symptoms, which met the criteria for bipolar II. Together, Brianna and her counselor created a treatment plan that would allow for Brianna to continue her studies and return to healthy daily life interactions. If you think you are experiencing symptoms of bipolar disorder, consider reaching out to a professional counselor for an assessment. Living with bipolar disorder can be difficult, but with guidance from a mental health professional and the proper coping skills, you will be able to manage your symptoms and start feeling better.